Here's a great case that I want to talk to you guys about. If you look closely, it doesn't seem very extreme. Looks like a very small dot in a tooth. Well, that tooth, when it experiences decay, bacteria eat away at the tooth through the production of acid, and that acid erodes at the tooth and leads to dysfunction in the tooth, kind of like termite damage. And so I always give that metaphor to folks because that termite damage is kind of like wood rot. It's very soft. And so what looks small here is not necessarily the outcome. And so after some removal of the cavity, we begin to open things up and we can see just how much more there is hiding underneath the tooth. The brown leathery area of decayed tooth leaves this tooth very vulnerable. And as it continues to decay further and further, that termite damage, so to speak, gets deeper and deeper. After just some exploration and removal of the initial decay, we find it continues to go much, much further. And so we have to continue to excavate that decay and bacteria. We end up with a situation where you can see the borders and boundaries of the tooth are very clean and the original color and function of the tooth are restored. We then treat it with a very mild antimicrobial to make sure we've eliminated the bacteria that you can't see, and then we seal this area up. We use a very biomimetic, very harmonious resin composite material that plays really nice with your body. After all is said and done, we end up with a restoration that honors the original shape of the tooth, that's sealed very tightly, and the form of the filling is such that it's less likely to gather bacteria in the future. So we like to try to take what we have and also leave it with some enhancements.